Condition of immune attacking on body is Guillain-Barré syndrome. It is also known as GB syndrome. Guillain-Barré syndrome is a condition in which immune cells attack on the own nerves of the body and damage the nerve, affecting and causing Guillain-Barré syndrome. When there is damage of myelin sheath that is covering the nerves and exposure of the nerves happen, then problems arise. There are many signs and symptoms are present like pain, demyelination, and a lot of findings are there in the GB syndrome. So this is the thing that presents with the Guillain-Barré syndrome: numbness, tingling, inflammation, and pain, temperature sensation will be affected. So in this way, Guillain-Barré syndrome patients present. And okay, so Guillain-Barré is acute inflammatory polyradiculoneuropathy. It is acute, occurs onset, demyelination. Poly means multiple, radiculoneuropathy. Multiple neuropathies are involved, and it is acute, regress progressively. Acute acquired demyelination syndrome of peripheral nerves due to autoimmune condition. It is acute peripheral neuropathy. Pathogenesis is autoimmune demyelination syndrome due to T cell mediated immune response. Demyelination is induced by macrophage and associated with certain infection like Campylobacter jejuni, cytomegalovirus, Epstein-Barr virus, or Mycoplasma pneumoniae bacteria can cause the condition. So it is inflammatory condition and demyelination happen in Guillain-Barré syndrome. What clinical findings will be there in this condition? Since it is demyelination, so there will be symmetric ascending paralysis, distal to proximal muscles, and then loss of deep tendon reflex, facial bulbar weakness, respiratory muscle weakness, and ventilatory support is required. Autoimmune dysfunction will be there, and Miller Fisher variant is present like triad of ophthalmoplegia, ataxia, and areflexia. How can we diagnose the condition? CSF finding will be albuminocytogenic dissociation, and electromyography reveals most accurate test, and it shows decreased conduction velocity in electromyography. So management for Guillain-Barré syndrome is regular monitoring for respiratory function, ventilation is required, plasmapheresis is done, IVIGG should be given in order to decrease the immune response and autoantibodies. There is no benefit of combining IVIGG and plasmapheresis. So this is the thing that you have to keep in the mind. And there is a mnemonic for Guillain-Barré syndrome, that is acute inflammatory demyelination, polyradiculopathy, ascending paralysis, autoimmune dysfunction, albuminocytogenic dissociation, and areflexia. 5 A's in GB syndrome. So you have to keep this thing in the mind, and you have to diagnose the condition accordingly.